Hello everybody, Uber Lady Charlotte here. I'm not Uber Lady Charlotte anymore. I'm Uniquely Lady Charlotte. Uniquely. I gotta get it right. Okay. Hello everybody, this is Uniquely Lady Charlotte. And I just left the dentist's office. So, man, my teeth feel so clean. I don't even want to eat. I'm scared to get them dirty. I don't even want to eat. And let me tell you, let me pull over. Let me pull over for a minute. Let me pull over. Cause I got to tell y'all about this dentist office. Today was my first visit. But let me tell you about this dentist office. Y'all know I don't do reviews just on anybody. And I don't shoot y'all any BS. Because I wouldn't want y'all to shoot me any BS. But let me tell you about this dentist office I went to today. It's in Concord, North Carolina. And it's called Branchview Dental Care. When I first moved into my apartment complex, they sent out a big flyer. And the flyer was impressive and high quality. And I read about their services. They go from general dentistry to whitening to surgery, oral surgery. I mean, they do it all in this office. Implants, everything. But the doctor's name, now I'm going to mess up his last name, and I'm so sorry. The dentist's name, this is at Branchview Dental Care in Concord, North Carolina. And the dentist's name was Kevin, and I'm going to just spell his last name, T-S-U-I. Kevin, T-S-U-I. And he's got the letters D-D-S and M-S beside his name. He also works at another clinic, at another practice, I'm sorry, Waterside Dental Care in Denver, North Carolina. So if you can, get up with Kevin. I mean, funny, nice, easy going, down to earth, didn't talk over my head with all these technical terms and all that crap. Very nice. But also, his dental hygienist, she helps out in different offices. Her name is Danielle. Okay, I think it's Amay or Amai, but I'm going to spell it. Danielle, A-M-E-I-G-H. Amay. That's what I'm going with. She was nice. She didn't hurt me. She didn't hurt me. She talked to me. You know, easygoing, had a sense of humor. And everybody in that Branchview dental office was very professional. Very professional. They got the little headsets on and the little walkie-talkie, and they talk to each other, and they tell you how much your bill gonna be when you come back, depending on what you need. Before you come back, they get your insurance, they pull the benefits, they read and see what your dental insurance is gonna pay. They don't try to flim-flam you, flip-flop you, or turn you inside out and do all those extra services where you have a bill when you leave. They don't do that. They're real nice, and they gave me exactly what I wanted. I said I want all the things that my dental plan pay for. I don't want nothing else. So that's exactly what they did. I appreciate that. One time before I went somewhere and I had a bill. They found out I had an HSA. Oh, all of a sudden I needed all kind of stuff. I left there with my HSA basically about stripped, naked. So anyway, check them out. Call them if you live in the area. They got Waterside. I didn't put my card up. But it's Waterside over in Denver, North Carolina. And they got Branchview here in Concord, North Carolina. They are nice and professional, and they know what they're doing. He gave me several options. He wanted to talk about a root canal over here. I got a big hole over here. But he said I may need a root canal. And then I said, nope, I'm just get it removed. He said, okay, that's fine. He said I could put a big filling on it. He said, but if I go in there and start cleaning it out, because I got to clean it out. I said, you got to clean it out? He said, I got to clean it out. And if I go in there and clean it out, it may irritate it. Because it hadn't hurt me ever. So he said, if I go in there and clean it out, it may start hurting. I'm like, oh, no, you know what? Don't even worry about that feeling. I'm going to just chew on the other side. You know, over here, I still got teeth over here in the back. So I'm going to just chew on them. Just leave this one alone. He was like, okay. He didn't try to talk me into getting a, what do you call it? A root canal with a crown. I'm going to tell you something about that. I have seen people, well, I know people, even as of recently, they go in and they get the root canal and the crown, and all they do is complain afterwards. They don't stop complaining. Oh, it's sensitive to heat. It's sensitive to cold. Oh, I can't really bite down on it. And that thing cost them almost $5,000. No. I'm not getting that. So I'm going ahead, get that one taken out. And eventually, my plan, he asked me this too. He said, so I know you want teeth, so what is your plan? Partials. He said, okay. So when I get to the point to where I need partials, because all these are mine, but when I get to the point I need partials, I'm getting partials. I'm not spending an Escalade payment on teeth. I'm going to just find me a man. I got a man that, like, he don't mind if I don't have teeth. He don't mind. But if this don't work out, then I just find me a man that don't have teeth. When you get close to my age and older, you lose them puppies anyway. So, but I'm going to still be cute. I'm going to still be cute. So I'm going to just have me some partials if the time ever comes. Right now, I'm taking care of them. So they in there. They in there. So anyway, I do have another cavity. It's just starting up in the between the teeth. And they actually told me how much it was going to be, what the 10% down was on the date of the service. They explained care credit to me. And so now I know 6 months in advance what I need to save up. But also, this is very important. I need y'all to listen to this. He was talking to me about my tooth and the the root canal and the crown. But I had a realization. I said, this is what it is. Let me be honest with you. I said, I'm a diabetic. I take medication, and the medication I need is over $600-700. So my first priority is to take care of that. So I can't actually get, the root canal and the crown and stuff like that. I'd love to have braces, and have straight teeth. I'd love to have a root canal with a crown. No, I wouldn't. I ain't gonna even lie. No, I wouldn't. No, I wouldn't. I ain't seen nobody happy with that. But implants, I'd love to have those. But my first priority is my medication, with exercising and diet and taking this medication. So I can't afford to, if I'm asking you guys for help to get my Trulicity, I damn sure can't afford to get, root canal and crown. And he understood that. He said, I totally understand. I get it. And I like that. I like that. Yesterday, I went and had my wellness exam at my regular doctor. And I had 2 new young ladies in there I had never seen before. Actually, the whole crew I had never seen before. One was an intern. She's going into the Air Force, she said, next month. Congratulations to you. I'm not going to put her name out there. And the other one was a medical assistant. She was very nice, and she was showing the intern what to do. And they were very pleasant young ladies, very. And then the PA wasn't my regular PA, and I'm not going to give her name. But she was very knowledgeable. Did you know that if you have diabetes, you're supposed to be on a cholesterol medicine anyway to protect your heart? She told me that. I didn't know that. I knew about the high blood pressure medicine to protect my kidneys, but I didn't know about the high cholesterol medicine to protect my heart, because I'm only 12 points over, and I can get them 12 points down as far as my cholesterol. But yeah, I didn't know that I should be on that anyway. Okay, all right, cool. She did mention my hyperparathyroidism, and I have a tumor on my hyperparathyroid, but I can't afford the surgery, so I'm not going to worry about that. But my numbers are low. They're 10.8 or something like that. So she asked me, what are you going to do about that? And I'm like, well, there's nothing I can do about that because I can't afford the surgery. But, you never know what will happen later. We all got stuff. And you have to prioritize. So, like I said, those ladies at my doctor's office were very, very, very nice. And then now it's to get some glasses. So I got an appointment set up for Saturday, March the 16th. I'm going to go to America's Best. So I talked to that lady over in North Lake, America's Best in North Lake. Very nice lady. Laid it on the line. She just wouldn't tell me how much my glasses would cost, because she said, I can't give you that information. So I'm like, if I bring in that's the amount of money, can I leave there with 2 pair of glasses? And she was like, yeah, you should be able to. And so she said they give free eye exams to America's Best. I've never been there before, but I've heard good things. So I'm going to go over there March the 16th. All right, now, Heidi Scotty's birthday is tomorrow. And I asked him what did he want to do. He don't want to do nothing. Is that typical for men to not want to do nothing? Because women, we want you to do all kind of stuff. Scale the side of a building, get a plane, happy birthday, boo thing, something. We want something. But he don't want nothing. He don't want nothing. He want me to make him some cube steak, vegetables, potatoes and gravy. So I'll do that. But we having street tacos on, I'm going to make some street tacos for for Sunday. So I'm going to do that. All right, I'm going to get ready to go. Oh, y'all know when I go to the doctor's office, I have a tendency to start looking at my surroundings and thinking about weird stuff. And I really want y'all to answer this question. I asked the lady, can I use the restroom first before we... Okay, so here we go. So here is a man in a dress. And I ain't got no problem with that. He's got purple hair. His hair not done. That's okay. He got a purse and everything. He identified what he identified with. That's fine. But my thing is, at least put on some clothes when you come outside. You just can't come outside looking any kind of way. Put on some clothes when you come outside. Don't matter what you choose to identify with. You still want to look good doing it. That's all. You want to look good doing it. Okay. Let me see. Oh, the bathroom. So I went in to go use the restroom. So, but you know the term, flip-flopping. Bathroom, restroom, bathroom, restroom. So, which one do y'all call it? Do y'all say I gotta go use the bathroom? I mean, you take a bath in there. Or do you say I gotta go use the restroom? Are you resting in there on the toilet? What are you doing? You just sitting there? Sometimes you do just get in there and you just sit and think. Sometimes that's just the best place to be. To conduct business, take a rest break, hide from your boss for just a few minutes, just get a little peace of mind. Just sitting there, just thinking. So y'all let me know. This is an interactive video. Restroom or bathroom? Which one y'all use? Restroom or bathroom? Also, that also brings me to this point. Y'all know how my mind do. Cause we just open. I'm just gonna talk to y'all. Dennis and I had this conversation. We were talking about drumettes. And so he said, they're not drumettes, they're chicken legs. We talking about the little ones. Some people call them wingettes. I said, chicken legs. I said, they're drumettes, that is. He said, no, they're chicken legs. I said, that is. Okay. Have you ever seen the term chicken legettes on the bag? He was like, no. I said, what's on the bag, Thaddeus? What's on the bag? He's like, drumettes. They are drumettes. Drumettes. Anyway, I'm going to go. Let me call Thaddeus. All right, bye.